Drugs are almost always used to improve health of sick patients. There are many ways to take drugs, like swallowing, inhaling, absorbing through the skin, or injecting through a shot. Every way has negative side effects, and not every way can be used for every medicine. The ways of delivering drugs that we have now can cause damage to healthy cells in the process. For example, the National Institute of Biomedical Imaging and Bioengineering tells us that taking pills for your allergies can cause an upset stomach. The need for improving what we have and enhancing existing drugs has pushed scientists to use nanotechnology to deliver medicine. These are machines so small that they're barely even bigger than atoms. This system of drug delivery can control the location in the body where it's released, which benefits the patient by targeting only the site of the problem. Normal medicines are delivered all at once, but using nanotechnology, they can be released at programmed times, like air fresheners in public bathrooms. It reduces the amount of times that patients need to take medicine because less of it is wasted on parts of the body where it isn't needed. In addition, using nanotechnology reduces the negative side effects by lowering the level of drugs in the rest of the body. Targeted drug delivery systems can treat many diseases such as cardiovascular disease and diabetes. However, the most useful application is for treating cancer. There are many types of cancer treatments such as surgery, chemotherapy, and radiation therapy. Some treatments are more targeted than others, but all have negative side effects on the organs around the cancer in the body. Using surgery to diagnose cancer can sometimes prevent it, and if the cancer has not spread, can positively affect the treatment. However, the damage it causes can be sometimes life-threatening. Chemo and radiation therapy have many negative side effects like nausea, body aches, skin problems, and low energy. Finding a new and improved method to limit the damage is an urgent need, and targeted drug delivery systems using nanotechnology have had great results. The nano machines work like microscopic mailmen, bringing the drugs exactly where they're needed, and the old ways like chemo and radiation put drugs all over the body, like an airplane dropping mail all over town instead of to your mailbox. The nanoparticles stay in the body longer so they can keep working, even if the patient hasn't taken any more medicine. They can disguise themselves as natural cells of the body and can sneak past the immune system to deliver the drugs right where they're needed. They even take advantage of the body's natural antibodies, which are used to identify germs and invaders for an active targeting strategy focused against tumor targets. Because they look like normal parts of the body, the immune system lets them into the cells in larger amounts than the old drugs ever could. This doesn't mean that any nano drug can be used in the body. Only ones that look like natural cell parts can sneak through easily. There are several types of nanoparticles used in drug delivery systems, which include polymers like tiny plastics, proteins, fats, and organic metal compounds. All of these look just like things that are normally in the body, but each one allows the drug to do certain things. In the body, proteins control almost everything that cells do, so they are used in these drugs to change the way cells act. The polymers help the medicine particles stick to the target so we can make sure they're where they need to be. Fats can decide whether or not the medicine will dissolve in water in the body or other fats, which is important in deciding where it will stay in the body while it is working.